Governor, if I may, I would like to talk to you about the funding vehicles for the CAP program. And I know that has been the center of the debate in the Pennsylvania legislature. And under your original proposal, the fair share assessment would have required businesses pay into a fund if they did not offer health coverage. And this plan was similar to the Massachusetts reform, but I understand that it was opposed by some lawmakers. Can you talk to us about the original plan and why you believe was some resistance to it, and how are you funding this initiative now?
Well, real quickly, we had three sources of funding. One, to increase our cigarette tax by 10 cents a pack, still keep us far lower than New York and New Jersey. Two, to tax smokeless tobacco products. Unbelievably, Pennsylvania is the only state in the union that doesn't tax cigars and smokeless tobacco products. When I came in, I said, that can't be right. North Carolina, Kentucky, Virginia, no, we're the only ones. So those were the two sources. And the third source was the fair share assessment that got at the free riders. And I believe, conceptually and in every way, that there shouldn't be free riders. Whether you're a small business or whether you're a 1,000-employee business, if you don't provide health care, you are driving up the cost of everybody else. If you've got 1,000 employees and you don't provide health care, everybody's premium. Every small business in the state who does provide health care is paying over 6% additional to their premium because of you. So we proposed a 3% payroll assessment, payroll tax, whatever you want to call it. Because it would have impacted on small businesses, it got very little support in the legislature, including by my own Democrats. Even though we phased it in for 5 years for small businesses, we had a lot of small business protections, but it still became, eventually you get the message, you're not going to get it through. I still think it's the best way to go. There should not be free riders in the system. Why should one machine shop with 10 employees offer health insurance to its employees, and the other, who's competing with it, 2 miles down the road, get away without offering health insurance, and those 10 employees get picked up in ways that we all eventually pay for, ratepayers, and the state eventually pays for. So as a substitute, it's really too complicated, not worth spending the time. But we have an abatement fund for our doctors from their medical malpractice insurance liability that they pay to the state. In Pennsylvania, you pay private premiums, and you pay to the state for the catastrophic fund. We abated that fund, especially for specialists. We abated it when we were in the middle of the medical malpractice crisis. We've kept that abatement on, and it's worked very successfully to stabilize the practice of medicine in Pennsylvania, but it's racking up big surpluses, so we're tapping into the surplus to cover all Pennsylvania.
Thank you, Governor. Mr. Chabot.
Thank you, Governor. First of all, I represent Cincinnati, Ohio, Governor, and I would appreciate it if your Steelers had quit beating up on my Bengals. So
next year.
All right, we'll see. Hopefully we'll do better next year. But my question is that there are some uninsured individuals, especially young people, who could afford health insurance who just choose not to be covered. What would you do? What do you do about individuals in that situation?
Well, interestingly, I favor mandating, so those people aren't free riders either. I favor mandating, but again, it was one that I knew. We have, as Representative Altmaier and Representative Sestak will tell you, a little bit of a conservative legislature, and I've dragged them kicking and screaming into the 21st century. But there were certain things that I knew I couldn't accomplish. And what we said in Pennsylvania, we'll try it without the mandate for 5 years, and then see if the free riders are hurting the system. You know who wants those 28-year-olds in the system? The HMOs, and with good reason. Because if we're going to force them to cover, and in Pennsylvania we intend to force them to cover cancer patients, everybody, they should have the right to have the healthy 28-year-olds in the system. In fact, they're called by the healthcare profession the invincibles. They're 28-year-old males. They never think they're going to get old. They've never seen a doctor. They don't think they have any need for a doctor. In fact, I was an invincible once. I was playing basketball, and I took a pass on one of my fingers, and I didn't go to the doctor for 3 days because I thought I could heal it myself. As a result, I have a crooked finger for the rest of my life. The Invincibles are the ones that everybody wants. In Pennsylvania, we've designed a bizarre system. If you have cancer and you're not covered, you can't get health care coverage. If you're a 28-year-old and you're perfectly healthy, everybody wants to cover you. It's, you know what, backwards. It makes no sense at all. It makes no sense at all. And to make the system work, to be fair, if we're going to keep the system of insurance companies delivering the basic product, and I think we should, I think you need to get the Invincibles into the system for the benefit of the insurance companies.
Thank you, Governor. Yield